Hey, good morning. I'm Vic Senese with UroNurse News. You know the drill. Today we're looking at a potentially important advancement in prostate cancer screening. For decades, the PSA blood test has been one of the primary tools used to identify men who may need further evaluation for prostate cancer. But a new study suggests that a more advanced test called Stockholm3 may improve the ability to detect clinically significant prostate cancer, while potentially reducing unnecessary biopsies. Sounds good to me. The question researchers are asking, could Stockholm3 provide a better picture of prostate cancer risk than PSA alone? Let's take a closer look. A large prospective study published in the Annals of Internal Medicine evaluated whether Stockholm3 could outperform PSA testing in identifying men with clinically significant prostate cancer, defined as grade Group 2 or higher disease. Researchers performed a secondary analysis of the Stockholm3 MRI trial, a population-based prostate cancer screening study conducted in Stockholm, Sweden. The study included more than 12,600 men between the ages of 50 and 74. Every participant received both traditional PSA testing, Stockholm3 risk assessment. The goal was to compare how well each approach identified cancers that were more likely to require treatment. Because when it comes to prostate cancer screening, the goal is not simply finding more cancer. The goal is finding the cancers that matter most, while avoiding unnecessary procedures for cancers that may never cause harm. So what makes Stockholm3 different from a standard PSA test? Well, PSA measures one thing, the amount of prostate-specific antigen in the blood. Stockholm3 takes a broader approach. Factors such as combining PSA levels, plasma protein biomarkers, genetic information including polygenic risk scores, clinical factors such as age and other patient characteristics. Now, these factors are combined into a personalized risk score designed to estimate the likelihood of clinically significant prostate cancer. So, kind of think of it this way. PSA provides one piece of information, while Stockholm3 attempts to combine, again as I said, multiple pieces of that information to create a more complete risk profile. The goal? Precision. Identify men who are more likely to have aggressive disease while reducing the unnecessary testing for those at lower risk. So what did the research find? Well, during the study, 443 men, about 3.5% of the participants, were diagnosed with clinically significant prostate cancer on biopsy. Researchers found that Stockholm3 provided a better balance between detecting important cancers and avoiding unnecessary biopsies. So when they compared Stockholm3 with PSA, Stockholm3 demonstrated a sensitivity of approximately 90%. Sensitivity. PSA demonstrated a sensitivity of approximately 74%. Now, sensitivity means the ability to correctly identify men who actually have clinically significant prostate cancer. Now, Stockholm3, 90% sensitivity, PSA 74% sensitivity. The study also found that Stockholm3 detected more clinically significant cancers. Approximately 31.6 cases per 1,000 men screened with Stockholm3 compared to 25.8 cases per 1,000 men screened with PSA. Researchers also reported that Stockholm3 resulted in fewer missed clinically significant cancers compared with PSA alone. Now that could be important because missing an aggressive prostate cancer is one of the biggest concerns in any screening strategy. So does this mean PSA testing is going away? Well, not yet. The study provides encouraging evidence that Stockholm3 may improve prostate cancer risk assessment, but additional questions remain. Researchers noted several limitations. The study population was primarily Swedish and European in ancestry, meaning results may not translate equally to all populations. Only a portion of invited men participated, and the follow-up period was relatively short. The study also did not evaluate cost effectiveness. Future studies will help determine which patients benefit most from the Stockholm3 testing, how it compares with MRI-based screening strategies, and whether it can reduce unnecessary biopsies in the real-world practice. how it fits with current prostate cancer screening guidelines. For patients, the message is simple. The future of prostate cancer may move beyond a single blood test. Instead, we may see a more personalized approach that combines biomarkers, genetics, imaging, and clinical information to make better decisions. Remember, I've always been saying, don't get a biopsy on a single PSA. That's today's update from UroNurse News. I'm Vic Senese. If you find this information helpful, be sure to subscribe to the channel to stay up to date on the latest advances in urology, prostate health, and men's health. Now, coming tonight on Dr. Jeff Talks About Sex and Intimacy, what happens beyond the bathroom can reveal important clues about a man's overall health. Tonight, Dr. Jeff is joined by Dr. Amir Farouk for an important conversation. Beyond the bathroom, what every man should know about urologic health. Many men ignore changes in urinary frequency, function, sexual health, and intimate wellness, but these symptoms may be connected to conditions affecting the prostate, bladder, hormones, blood flow, and overall quality of life. So, be sure to join drjeffsextalk.com tonight at 7 p.m. And join us tomorrow on UroNurse News. Could your doctor someday prescribe chocolate? May sound too good to be true, but research suggests that dark chocolate may offer surprising health benefits, including helping support your heart, your brain, and even your metabolic health. We'll separate fact from fiction, explain what the science really means, and reveal which type of chocolate may actually be good for you. So you got to watch tomorrow.
UroNurse News every weekday at 9 a.m. Central Time, bringing you the news that shines.